So what is narcolepsy? In its most basic sense, narcolepsy is a sleep attack, an act of a person falling asleep for no apparent reason. This is how the media portrays narcolepsy, when in reality, there is so much more. Some common symptoms of narcolepsy include drowsiness, restless sleep, insomnia, sleep paralysis, hallucinations, abnormal eating patterns, and cataplexy. There are varying degrees of narcolepsy, ranging from narcolepsy with cataplexy, usually being the most severe case, which includes loss of muscle tone, increased muscle fatigue, loss of muscle control, and all the way down to minor narcolepsy, which includes only minor drowsiness.
To tell you about the inheritance patterns of narcolepsy. Inheritance of narcolepsy is random. It just appears for some people, but studies do show that there is an increased risk for immediate family. It's mainly triggered by environmental factors, such as high stress environment, poor diet, and poor hygiene.
Hey there, neighbor. Let me tell you about some of the molecular mechanisms associated with narcolepsy. So, the cause of narcolepsy for a long time has been believed that it was a mental illness or psychological disorder. This, however, is not true. Narcolepsy derives from a heterozygous mutation on an HCRT gene on chromosome number 17q21. This means that on a particular chromosome at a particular spot there was a mutation. This HCRT gene encodes for a neurotransmitter or a chemical named orexin, which is also known as hypocretin. This chemical is expressed all throughout the brain, and this neurotransmitter orexin is responsible for the regulation of arousal, wakefulness, and feeding behavior. The reason that narcoleptics experience such terrible sleep attacks is because of a lack of this neurotransmitter orexin in the brain. The mutation on the HCRT gene causes these orexin-producing cells to act as antigens to the immune system. This means that your immune system looks at these orexin-producing cells as foreign invaders and kills them. Cells created by this mutated HCRT gene have variations in their peptide bonding, which causes the immune response that kills the cells.
However, the reason why the variations in peptide bonding cause an autoimmune response is unclear. Testing for narcolepsy is very tricky since there are so many varying forms of severity for narcolepsy, and one person may not even think that they would have narcolepsy. As far as testing goes, there are two main types of tests that can be performed in a clinic specializing in sleep disorders. The two main types of testing are called polysomnogram, or PSG, and multiple sleep latency test, MLST. A PSG is done during sleep and records one's sleeping patterns, brain activity, nerve activity in muscles, and abnormal REM sleep cycles. The MSLT is performed when the patient is awake and measures the person's tendency to fall asleep, and also records any abnormal REM cycles while the patient is awake, which is a symptom of narcolepsy. Another helpful and insightful test is human leukocyte antigen typing, which can be used to map a person's genes to find out what type of HLA they have and to figure out if they are at risk for narcolepsy.
As far as treatment goes for narcolepsy, there is no actual cure for narcolepsy. However, there are treatments such as maintaining a healthy lifestyle, which means a good diet, no smoking, and living a low-stress lifestyle. This treatment is most effective at treating narcolepsy.
New technology is being discovered, as far as I know, but further research is being done on narcolepsy.
But how common is narcolepsy? Well, it is estimated that every 1 in 2,000 people have some form of narcolepsy, but it is largely undiagnosed due to the varying forms of narcolepsy.